Hello, I'm Dr. Derek Carroll with Back to Health Chiropractic here in Loveland, Colorado, and I just wanted to take a moment today and talk to you a little bit about different ways that people can approach their chiropractic care. There are really three ways that you can approach care. One is the acute pain relief model, which is basically our Band-Aid care, our owie care, okay? So it's the, I want to get out of pain right now, and I'll call you the next time I hurt type of care. And a lot of people have used chiropractic care in this way for a lot of years. But the unfortunate thing is that it's really not the best use of chiropractic care. It's definitely better than popping an aspirin or something like that when you get a headache. You go in and get an adjustment, get rid of the headache, and you feel much better. But it's not going to give you long-term results. And one of the big reasons for that is you actually have three parts of your nervous system. Okay, you've got your motor function part, you've got your autonomic or the automatic side of your nervous system, the part that takes care of all those different things you never think about, your heart rate, your blood pressure, whether or not you sweat when it's hot, whether or not your pupils dilate when you step into a dark room, all those things that are occurring in your body that you never think about. And then you have your pain or sensory part of your nervous system, which is, it only takes up about 10% of your overall nervous system. So we tend to pay the most attention to the part that barks the loudest, but it's not the most important part because you want your muscles to work, you want all those other functions to work. So pain is an indicator that something's going on, but the absence of pain does not necessarily mean that the problem has been corrected. Okay? So the next way that we approach chiropractic care is rehab care. After a thorough examination and we find out everything that's going on with you and what needs to be corrected, whether or not there's degeneration or loss of proper curvatures in your spine or whatever it happens to be, we go through a plan of care that helps to remodel the ligaments and the joints and the muscles and get everything trained back so it's supporting your spine properly so that you don't continue to have the same problems happening over and over and over again. And that's the part that really helps the nervous system to start functioning properly and heal well. And then we can progress on to our third way of addressing chiropractic care, which is our wellness model. Okay, so if you've ever been to a dentist and they tell you that they want to see you again in 6 months to make sure they keep your teeth clean and healthy, it's the same concept, okay? Taking care of your spine means that you're going to take care of yourself. It's going to keep your spine from degenerating early, it's going to help keep things functioning properly, and it's going to keep your nervous system functioning at its highest level so that you can be the healthiest you that is possible. So those are our three ways of approaching chiropractic care, and really the only way to reach that wellness model is to make sure that you stick with your doctor's recommendations so that you actually get well, you rehab your spine, and get yourself back to health. Thank you very much.